the inner chatter, and it's really difficult to kind of overpower that with your will and tell it to go away because I'm trying to, pray or I'm trying to meditate. What does work, for example, is when we really notice the world around us. Just watch the leaves move in the wind, or watch the sunlight dance along with the shadows. Or one of the best for me is laying down and watching the clouds go by.
This is the Transformational Life Consulting Podcast with Deepa Grandin, MD, where Christians like you get the practical support and tools you need to build your spiritual, mental, and physical well-being, and to guide you on your journey to health and wholeness based on evidence-based science and God's Word. I am your host, Dr. Deepa Grandin. Thank you to all our regular listeners for taking the time to listen to yet another episode of Time to Transform. I would also like to extend a warm welcome to our first-time listeners. We hope you find the information provided useful and will continue to make Time to Transform part of your spiritual health and wellness journey. In today's podcast, we will be exploring forest therapy. This type of therapy is probably the most fascinating and my all-time favorite kind of lifestyle intervention because I absolutely love nature, and being in nature personally makes me feel relaxed, closer to God. Psalms 19 talks about God's creation and it being the handiwork of God. So it is not surprising that being in nature provides a healing, soothing environment. For those of you who are not familiar with forest therapy or nature-based therapy, it's basically just a nature-based intervention that involves immersing yourself, immersing your mind, being in nature, especially in like a forest environment. And it has been shown to promote beneficial changes in your mind and in your body. So we have a lot of research right now from environmental health, something known as psychoneuroimmunology, that is basically the interaction between your mind, your nervous system, your immune system in positive ways that benefit your body and your mind. And having these studies has shown that spending time, say, in a forested setting especially, can significantly lower your blood pressure, reduce heart rate, reduce your stress hormones such as cortisol. And the way this works, it's something we call multisensory, meaning you engage your sight, you engage the sounds, the sense, the texture. All of this has been shown to activate your parasympathetic nervous system. So usually when you are stressed and anxious, it's your sympathetic nervous system that's activated. But when you're calm and relaxed, it's your parasympathetic nervous system. So using this multisensory approach helps to activate that part of your nervous system that helps to calm you down. And it has been shown to improve your autonomic balance, which is basically, again, how you activate that part of your nervous system that helps calm you down. And this helps to also reduce markers of inflammation. So having these outcomes particularly relevant in the context of chronic stress-related illnesses, including heart disease, anxiety disorder, immune dysregulation, we are always looking for ways to naturally counter these types of effects on the body. So beyond its effects on the physical body, it's also shown, this forest therapy, to contribute a lot of benefits for your mind, for your emotions. And the way it does that, it enhances mood, it increases your attention capacity, it helps foster a sense of connectedness to the natural world. So studies in eco-psychology, meaning your environment and your mind, cognitive restoration, which really just is your mental ability to process information, solve problems, make decisions. The cognitive resources that we always rely on seem to get depleted with urban living and digital overstimulation. So we find now that forest therapy can actually help support regain or replenish some of these cognitive resources that we rely on a day-to-day basis. And it helps to build something known as mental resilience or toughness. So part of mental toughness is not just being able to face the grind day in and day out, but it's also how to keep yourself calm when everything around you is just telling you to like throw in the towel or get stressed out, right? So forest therapy has been shown to improve mental resilience by providing a space where you can get reflective, you can calm your emotions, and it's also a way you can interact with others in a non-clinical, low stigma setup. And more healthcare practitioners, as well as individuals, they're looking for integrative and preventative strategies to improve their health. And forest therapy is now found to be a great, compelling, evidence-informed practice that aligns with both traditional wisdom and contemporary science. To help us understand this type of therapy better, we are truly fortunate to have Dr. Susan Abukhayr. Dr. Abukhayr is an assistant professor at Harvard Medical School. She is a senior executive with 20 years of experience leading healthcare organizations. She has served as chief medical officer, system chief quality officer, and is the past chair of quality and patient safety at Mount Auburn Hospital. Dr. Abukhayr began her career as an electrical engineer in aviation systems. As a graduate of Harvard Medical School, Dr. Abukhayr trained at Brigham and Women's Hospital and practices internal medicine. She received a master's degree from the Harvard School of Public Health and has taught nationally and internationally on patient safety, high reliability, and systems design. Dr. Abukhayr is a certified forest therapy guide. She provides nature-inspired individual coaching, group coaching, leadership development, training, and retreats to healthcare professionals. Dr. Abukhayr, thank you so much for taking the time to do this podcast on the impact of nature on health and well-being. Before we get into this topic, please tell us a little bit about yourself. What caused you to transition from electrical engineering to physician executive to forest therapy guide?
Thank you very much for having me. I'm delighted to be here, and hello to all of you listening. I'm often asked what caused my transition from electrical engineering to healthcare and then to nature-based health care practices. And what looks like a change in my career path is actually simply a continuation of my lifelong love and fascination with relationships and interconnectedness and understanding how things are interconnected. When I was an electrical engineer, I was an aviation systems engineer. So that was a discipline of integrating electronics and regulations with human factors and design, all to bring together a way to optimize, aviation safety and navigation. My bridge to medicine started really quite young. I was quite young, even before being an engineer, when I developed a fascination for neural networks. And I was, again, the relationships. I was fascinated to understand how the relationships between neurons in our brain and these neural networks, how the relationships in the networks would affect our emotions and our thinking. And so I had always intended to go to medical school, and that was the bridge that led me from my initial foundation of systems engineering to medicine, where at a certain point in my medical training, I had to give up my goal of doing neural network research, but I certainly maintained my deep love of understanding complex systems and the relationships. And so after my master's in public health, I was really fortunate to be in the right place at the right time and launch a leadership career designing healthcare delivery systems. Again, looking at the context of care and how the relationships between all of the parts of the healthcare system affected the safety of patients and the quality of the outcomes, as well as the experience of giving and receiving care. And then about 6 years ago, I discovered forest therapy. And it just immediately spoke to me. I've always had a personal, lifelong relationship with nature, and it's been my source of solace and inspiration. And I became trained as a forest therapy guide, originally really not knowing exactly where I was going with that. But I then began, for the last 6 years, a journey of bringing nature into healthcare, starting by supporting physicians and other healthcare professionals by offering forest therapy experiences, and then more and more incorporating this beautiful practice of forest therapy into healthcare programs.
Wow, yeah, that is, I mean, I just love your story because a lot of people also ask me, like, how did you transition from traditional medicine and now, lifestyle focused? And it's truly such a personal journey, right? Things that happened to you as a person, like for me, after my kids were born, how it affected my health and how it made me open my eyes to lifestyle choices. Because I was always preaching lifestyle to my hypertensive type 2 diabetics. And
Right.
after my second child was born, looking at all the weight gain and trying to decide for myself, yeah, I need to make these choices now so that when I'm in my 40s and 50s, I'm not going down the same path as my parents, and then transitioning into lifestyle. So it was really that one thing led to another. And in your instance, like all the electrical connections and then the neuronal connections, it all makes so much sense. So, yeah, what a beautiful story. Thank you for sharing that with
Thank
us.
you. Thank you.
So, with the increasing urbanization worldwide and land use change, we know there is a growing disconnect between humans and nature. And in your study, what have you found in how this has impacted our physical and mental well being?
There are at least 40 years now of research demonstrating the health benefits of nature. And as you mentioned, the physiological health benefits and the psychological health benefits and the cognitive health benefits, and for many, the spiritual health benefits. And the totality of all this research, in part, is showing how we belong in nature, how we really, our bodies, our minds, our spirits, have been sort of born in nature. We grew up in nature as humans. We evolved in nature, and so much of the research shows that when we reconnect to nature, we're really reconnecting to a sense of belonging to something bigger than ourselves, a sense to spirit, a sense of belonging in something again bigger than ourselves. And when we're disconnected from nature, we find that we're sort of disconnected from remembering in some ways who we really are, that we are beings among many other beings, that we are alive and interconnected with the rest of the universe and the rest of the planet.
Yeah, of course. And then, I mean, I'm just really astounded. You live in Boston, I live in Boston, and just the number of people with mental health issues, you can just see them on the streets. And
Yeah.
it just makes me wonder how much of it has to do with the way we live these days and how disconnected we are with just living naturally, right? Because with how much electronics is introduced at a very young age, the highly processed foods, and
Right.
again, the lack of social connection. And I'm sure COVID did a number. Yeah, it's just really astounding to see where people are headed from a mental and physical perspective and how much of this has to do with the way our lifestyle has changed.
Yeah. I totally agree. And it's it's both heartbreaking on the one hand, but also, solvable, or we have, and, over the years of my study, as much as I'm devoted to restoring our connection to nature, I have found it's really also our connection to each other.
That's right.
And so some of the forest therapy experiences and other nature experiences bring us together, as well as bring us into relationship with the trees and all of the other beings on the planet. It also brings us in relationship and to each other. And that's what we really all need. I mean, it's great to have mental stimulation and work to do. And some of that can be electronic, but fundamentally, we are humans who need each other and the world, the real natural world.
Absolutely. So you did touch a little bit about the scientific research. Can you give us a little bit more information about the benefits of forest therapy and how does it impact our mental and physical well-being?
Sure, and it's a big topic. I'll just maybe mention a few highlights because, as I said, there is 40 years of research. So, on the physiological side, it's forest time in nature is shown to boost our immunity, for example. And one of the beautiful ways that we share our way of being with the forest, with trees, is through the molecules or the organic compounds known as phytoncides. These are volatilized organic compounds that are part of the tree's own immune system, protect them against fungi and other invasive species, and they're signaling compounds. When we are bathing in the atmosphere of the forest, which is the translation of the Japanese term Shinrin-yoku, where this all started, which translates to bathing in the atmosphere of the forest and inhaling these organic compounds, of which there are thousands. The way when we inhale these, it boosts our own natural killer cells, the activity as well as the number of natural killer cells. So again, it's one of the ways we're connected. Our immune systems and the tree's immune systems are interrelated in this way. Also, as you already mentioned, time in nature, especially time that is guided into a slowness, a way of slowing down, activating our parasympathetic nervous system, helps reduce blood pressure. It increases heart rate variability. All of the benefits of having a more balanced autonomic nervous system. By balanced, I mean allowing the parasympathetic, the rest and digest autonomic nervous system, come into balance with our sympathetic nervous system, which is often supercharged by our interruptions and our digital world. By activating, it helps our digestion, it helps our cardiovascular system, even pulmonary health. People who live near green space have better or fewer asthma rates and fewer bronchitis, fewer pneumonias. So there's many physical benefits all the way from, and even in OBGYN, there are people who have studied proximity to green space and the relationship between that and appropriate birth weight babies born. So as I said, there's many physical benefits. This is maybe just a few. There are psychological benefits. There are many, many studies showing that people's mood increases after time in the forest, or by forest. Sometimes, you think, oh, I have to be in a dense forest, in the jungle. And really some of this time can be, sitting quietly on a bench in a park. It's not all forest. It's relationship with the natural world that is really underpinning a lot of this. And studies on mood states such as depression is lowered. That people have less rumination after a walk in the forest. Rumination is associated with mental illness and depression. People have lowered anxiety. It's even with children who have attention deficit disorders, pay better attention after time outside. So there are, again, numerous studies throughout the literature on showing these benefits. And then, the cognitive benefits are really wonderful as well, because as you already mentioned, when we spend our time problem solving, I'm going to just use that term globally to refer to what most of us do all day long, sit and maybe interact with a computer, or, at work, or problem solving, or looking at our schedule, or, kind of keeping track. That kind of mental work is amenable or vulnerable to fatigue. That part of our brain that pays attention and solves problems can be fatigued. And there are some beautiful studies and frameworks that show how our ability to pay attention to things can be restored out in nature. It's thought that the ability to attend to something, to pay attention, which is also to be present, with our family, with our loved ones, with our own needs, the ability to really pay attention and be present. It requires some work on our mind to inhibit any distractions, and that's where the work is done, and that's the part of our brains that are restored when we're in nature. And this is shown in functional MRI studies and other neuroscience support for this whole theory of attention restoration.
Wow. Yeah, that's really, really fascinating. And like you said, and I think now there are so many different theories out there. It's like a whole topic of its own that we can spend hours discussing.
It is.
But I like how you share that you don't have to go to a forest. You can go to one of your local neighborhood parks and still have that same benefit. Because I am an asthma physician, and one of the things that we found with a lot of the asthma research is, especially children living next to the freeway, the prevalence of asthma in these children are way higher than children living near parks or a blue zone, which is like a lake or the beach or something like that. Just nature has its way of cleaning the air. And all the damage that we impose with the use of our cars and the natural fossil fuels, all of the volatile, the particle size with carbon monoxide, carbon dioxide production, ozone problems. So all of those can be countered by the green spaces. And so even at a level that we don't even understand, inhaling all the toxic pollution makes living in a big city, the more parks, the government, from a government level, policymakers, those are things that they should be looking into, incorporating more of these green spaces, especially in the big cities, because it impacts so much that we don't even, beyond our visual, right?
We don't see.
Yeah, exactly. So it's so important.
Yeah. And some of that is the direct effect, say, of, inhaling pollutants, for example. But there's also a lot of research about the role of chronic stress, just increased baseline chronic stress, and how people living in cities, have higher rates of stress hormones and exhibit physiologically increased rates of baseline stress. There's a lot of research now showing how that alone contributes to many chronic diseases that we see, such as asthma and many other diseases, and that by being out in a natural environment, when we, breathe deeply, when we inhale the atmosphere, when we interact, and, even just getting in touch with our physical senses, our touch, our smell, watching the sunlight, when that activates our parasympathetic nervous system, it also is reducing a lot of our stress hormones. So many of these other illnesses are, the reason why there's so many illnesses that time in nature helps is because there's these common themes that affect all of them, such as stress.
Yeah, very true. So what are some specific practices that you guide your patients or participants through while you're doing a forest therapy session?
Mm-hmm. A forest therapy session is a very specific kind of a guided practice. We go outdoors, obviously, and it can be, anything that feels like nature, which is just complex enough outside to feel like you're away from the indoors, and can interact with, more than one kind of different kinds of beings. So we go out in nature. It's a very slow guided walk. So I initially bring my participants and or patients through a series of invitations into awareness and groundedness through all of our senses. So one by one, I invite people to tune into our sense of smell, our breathing, our touching, our sense of touch, our hearing, our listening to the sounds of the forest. And one, by these invitations, I help people to become really grounded physiologically in their senses. And that's a bit of a journey. That's how we start the forest therapy experience, is with this journey into a much more relaxed state, but it's also a state of being kind of open to experience as opposed to thinking. We take people sort of out of their heads, if you will, into their body, into our bodies through our natural senses. And then there are another series of invitations that deepen that state. And this is then followed by what we call relational or partnership invitations. So once people are kind of in a grounded state, and able to really notice the world around them, even though they may have been to that same park or forest a million times, now they're really noticing what's around them. And so they're really awake in a beautiful way. We open the door to other kinds of experiences of relationship with the forest, with the trees, with the beings, with all of the creatures. Including, rivers and water and rocks, all of the beings out in nature. And that helps us to really deepen the participant's sense of belonging as well as just physical well-being. And people then we open the doors for people to have experiences that suit them, whatever. It's not super prescribed. So many times we say people, the therapist, the forest therapist, which is not a mental health therapist, the therapist, we say, opens the doors. The forest is the therapist. The guide opens the doors. I misstated it a second ago. The guide opens the doors. So what we're doing is opening doors and allowing people to interact with nature in a way that helps them heal in whatever ways may be necessary or desirable for them at that moment.
Yeah. So, for me, I'm a practicing Christian, and for me, the nature is so eye-opening to the creation of God and how intelligent the whole design of nature is, how we are so interdependent. Now that you're talking about these things, one of the things I do with some of my coaching clients is the 1, 2, 3, 4 mindfulness practice, like 5 things you can see, 4 things you can hear, 3 things you can smell, so I can totally understand what you're saying. One of the things that I have noticed as being a very busy person myself is how we keep driving ourselves. And there is this external noise, but there's this internal chatter,
right,
which in my own practice has been the hardest to tame. It's like this wild animal. Like anytime I'm trying to do my mindfulness or even spend time in prayer, in that short time, even if it's 5 minutes, immediately thoughts come in. Oh, you need to prepare for this. And how about this problem or that problem? It's like the wildest beast is your own internal voice.
Yes.
And having this guided practice of observing and touching, while you have some of these natural things that happen, like we were talking about breathing the fresh air, and the natural particles that are being emitted by nature and how beneficial that is. Because we always talk about, your gut microbiome, eating healthy. how much more when you're in a clean air environment that has been cleaned by nature,
Hmm.
photosynthesis, where carbon dioxide is being converted to oxygen through the sunlight, and
Hmm.
the chlorophyll found in the leaves. I mean, all of that natural thing happening, which is beyond what we're paying attention to, but then using that natural environment to refocus, to
Hmm.
recount ourselves, to detox our brain, really.
Right.
And
It
yes,
is.
that is so powerful.
You said it so well, and it is like cleansing. I mean, for example, you talk about the inner chatter, and it's really difficult to kind of overpower that with your will and tell it to go away because I'm trying to, pray or I'm trying to meditate. I mean, it just doesn't work. But what does work, for example, is when we really notice the world around us. It's sort of, for example, a trick. I don't want to call it a trick, but I often, if I'm working and I need a break or I just need to reset, I might just step outside and just watch for a few minutes, just watch the leaves move in the wind or watch the sunlight dance in the, along with the shadows. And that, or the best, one of the best for me is laying down and watching the clouds go by. Just literally watch the clouds. And that tames that beast, because it connects us directly to the powerful part of who we are, which is simply being alive. And it really does, it sort of short circuits all that so that we can really have a break and reset.
Yeah. So, we live in this really fast paced, urbanized world, and many people feel disconnected from nature. So, how can people who live in cities incorporate elements of the forest therapy into their daily lives and in a way that fits in their schedule?
Right. Well, of course, one way is to find a forest therapy guide and go on a guided practice. But of course, I realize that isn't available for everyone or even practical for everyone. But I do recommend it because it's great to have a guided experience. But having said that, it's certainly not necessary or a fundamental part of being connected to nature. The best way to sort of begin, I would say, being reconnected is find little ways throughout the day or certainly throughout the week to go outside. This again can be your front porch, your backyard, down the block, and simply just sit on a bench and just watch what's around you. Just try to take some time just to be outside. Now, a lot of people have a hard time slowing down, even when they're outside. People have said to me, if I say I'm beginning at the forest therapy guided practice and I talk about we're going to slow down, and someone will say to me, I don't know how to slow down. Like, well, that's why we're here. That's what we're going to do. So people have forgotten how. And so it's if you go outside and you say to yourself, slow down, that's really not going to work so well. But if you go outside and just take some nice breaths, smell the air, even your morning coffee, smell the air, just spend some time, watch the movement in the trees, watch the sunlight, just see if you can spend some time noticing what's around you. And that maybe you can only do that for a few minutes before you start thinking about your laundry list of things to do. Then that's great. Do it for a few minutes and then do it some more and do it regularly. We have this practice in forest therapy called the sit spot, which has sort of become one of my foundations of everything I do now, which is find a place in your world. Again, it might be in your backyard. It might be a little scraggly tree. It can that you can just go to on a regular basis, and just sit in that spot. Sometimes you might want to bring a question on your mind, something in your heart to that spot, and just bring it with you. You don't have to think too hard about it. Just bring it with you and have a regular practice of going someplace in your environment in nature. I encourage people to bring plants into their home. Uh, you know, as simple as that is, it is another way of interacting with the living world, and try to include that in your daily life. So the main thing is to, when you go outside, take out the earplugs, not listen to a podcast. Sorry. Unless it's, a great one like this. I'm just kidding. But, and just use your eyes and your ears and your hands to notice what's around you, and sort of build up that practice on your own.
Absolutely. I mean, yes, there is a time and place for the podcast and the music, but there's definitely a very important piece we miss, is that time of stillness.
Mm-hmm.
Like, we no longer are in connection with ourselves. And then we wonder why we cannot connect with anyone else. How are you supposed to connect with anyone else when you don't even know who you are, right? And I think really that time of reflection, just thinking about what happened today. And, I just recently interviewed another lady who is a functional medicine practitioner who promotes intentional living. And one of the things that she was talking about was the self-love, and how so many of us have those negative self-talk, which we just suppress and keep down. And we don't take the time to even explore, where are these thoughts coming from? Why do I have them? Right? And then learning to love ourselves, forgive ourselves, to invite God into our journey. I mean, these are so important for healing. And unless we take time to heal ourselves, it's hard for us to give that love and gratitude and generosity to the people around us, because we live in a very hurting world. And it may feel like, oh, you're being so selfish, but taking that time for yourself to heal, it's kind of like the analogy I use is on the plane. They always say, put on your own oxygen mask before you do it for anyone else, because if you're dying, you can't really help anyone else. So you need to take that time for self-reflection, being with nature, spending time with God, spending time with prayer, and forgiving yourself. And you need to make that space, or it's just not going to happen. So there's
true.
so there's often this confusion: forest bathing, forest therapy. Is there a distinction between the two?
Yes. So this was all inspired by forest bathing, which started in Japan in the mid 1980s. And it was really just, the country of Japan has historically a beautiful relationship with nature and its culture. The health ministry of Japan started this practice of forest bathing to address the increase in chronic disease. They noticed an increase in the prevalence of chronic disease in the mid 1980s, and so wisely attributed that to the shift in the economy from an agrarian rural economy to an increasing technological urban economy. So they created what is called forest bathing, hundreds of trails throughout the country, and people, the health ministry invited people in the workforce on a regular basis would go out and simply bathe in the atmosphere of the forest. So they would go and lie and, listen to the birds and feel the sun, and just simply be in the forest. And then forest therapy is a practice that is a Western practice, started in North America about 15 years ago, and is a guided practice where forest bathing was self-guided and beautiful in its own way. Forest therapy is a guided practice, and I think it's particularly helpful, like what we were talking about earlier, that people have a hard time slowing down. They might go in nature and think, I have to jog, I've got to do something. It helps guide people into slowing down and into connection with all of our senses, as well as into relationship. So this guided aspect of the practice is what is known as forest therapy.
Okay. Yeah. So that's great. That's good to know. So from some of my own reading with the forest therapy, it seems to heighten like sensory awareness. And I know you had spoken about getting people to tune into their senses. So how does this activity where you tune into your senses, how does that contribute to healing?
Well, one way that this is understood is the difference between like what we call bottom up processing and top down processing. So top down processing is kind of what we think of as thinking, thinking our way through the day from the executive functioning of the cortex, making decisions, making plans, solving problems. And as we said earlier, that is subject to fatigue. When we are doing bottom up processing, what that means is we're literally using the part of our brains that are fundamental, our brainstem, our senses, our cranial nerves. We're actually getting back into the kind of processing that starts from not from all the many thoughts that we can generate in our own heads, but from the world into us through our senses, what we perceive, what we sense, and it activates through our brainstem a different way of being, a different way of thinking, a different way of processing, this bottom up. And all of that activation through our smell, for example, through our sight and sound, that part of our brain, if you will, is really connected to hormones, to the parasympathetic nervous system, to the whole neuroendocrine axis, and it activates well, what it does, it inhibits a lot of the stress-related kind of hormones and activities, and it activates a lot of the healing processes, the immunity. That's how the phytoncides get activated. That's how, the phytoncides activate the immune system, is through the smell and through the hormones it activates. So on the one hand, it's kind of a very neuroscience-y type answer, but it's really part of it is really returning in our way of being, in our way of thinking to a really huge component of who we are, and letting rest all that other stuff that's going on in our head, giving it a rest. So the healing in some ways comes from just returning to our natures and taking a break from all the stress-related activities.
Yeah. Yeah. It's amazing because it's there. It's not like you have to spend millions of dollars trying to achieve this, right? And you're trying to prevent your day-to-day living causing disease. Now you're being intentional and taking those steps to prevent going down that path where your lifestyle is causing you to be diseased. Now you're using your lifestyle to prevent diseases.
100%. And on the one hand, it sounds maybe simplistic, go and smell, smell the air out among the trees. It is both simplistic and also very profound at the same time. It's simple. As you say, it's free. It's accessible to us, but we also have almost universally have to relearn how to do it, because we're so conditioned in a way to be reacting to the distractions and going to the next thing, like you said, the beast, that it takes a little bit of learning to unwind, and the more time we spend doing it, the more unwound we can be. It also, in a way, is so much deeper than, activating our olfactory bulb. It's deeper in the sense that when we develop a practice of going and activating our senses, but also being in relationship, like such as through a sit spot, it's a path also to really deepening our belonging and connectedness to this beautiful world that we inhabit. So there are really spiritual elements and layers that come into play the more we practice it, and the more we practice being outside and the more time we spend.
Yeah, so you've actually mentioned the sit spot a few times. Can you explain a little bit more what that is?
Yeah. It, again, sounds simple. It is finding a place in your life, again, that you can easily access. It's not, a journey that you have to take very far. Stay within 5 minutes of your back door, ideally. Finding some place where you can go on a regular basis and that has some features of nature to it. Again, doesn't have to be a forest, might be a set of rocks, might be a little creek, might be a few trees, might be your backyard, but a place outside that is you develop as your own. And the sit spot is a practice of returning to this place maybe 3 times a week or more, and at first just learning just to go there and simply be, sit on the trunk of the tree or whatever, the rock that you have, and cultivate the art of simply being rather than doing. So sit, and maybe by trying to balance your thoughts, maybe by looking and watching what's around you. Notice the ants running around, look at the beetles, watch the leaves move, and cultivate this spot and do it frequently. Again, 3 times a week, but every day is ideal. The more, the better, really. And as you cultivate that spot, you develop a relationship with that rock or those trees or your spot. And as time goes on and you practice this, you can also bring to your sit spot some of your deeper questions. Just bring them with your heart, not with your head. Just ask, what should I be doing now? Or what is the best way for me to help my son? Or whatever is on your mind or in your heart. And it's a place where you can just go and be with that question. And often you can come back and find wisdom and tap into things that, by having sat with it in that way, are available to you. So the sit spot is this practice of finding your place and visiting it, regularly. Does that make sense?
Yeah, it does. Because, like I shared with you, I also spent a lot of time in Dubai, Abu Dhabi. This time of the year, it's so hot. And I know I have a lot of listeners who live there. So I always encourage people who live, and for instance, in the Boston area, the winter is a time you can't really go out and be with nature a lot, but you can do it from inside looking out.
Yes.
So maybe your sit spot could be a big window, or even within your home, you can have a natural place if you're not very good with plants, even if you get some fake green plants,
right,
or little water themed decoration in your house, or even images. I think images are very powerful. I remember doing recently my calcium score, which is a CT scan. And right above, even as I was laying down getting ready for the CT scan, it had a beautiful picture of the blue sky and a date palm. And although my mind knew it was fake, it just felt so relaxing.
Absolutely.
Looking at it. So I think even having these images in a place like your sit spot where you can just unwind, just empty out your brain, take some time for stillness instead of just going immediately watching Netflix. I think I can equate it to where you're eating highly processed foods. Yes, it feels great at the moment, but the impact it has on your body is just not worth those few minutes of pleasure. And I think just as you would be intentional in eating your fruits and vegetables, you need to be intentional in taking that time for stillness, being with the green space, whether it's imagery that you have inside or with real nature. But take that 5 minutes of stillness to empty your brain, and don't just get on social media, get on your electronics, your Netflix binge. You need that time of connecting with yourself, with others. Yeah.
And it's a practice to cultivate. It sounds so simple, but because of the way our lives have been, it takes practice. And other ways of bringing nature indoors. I mean, if you're out wandering around and you see a rock that appeals to you, or the feeling of holding a rock, especially if you need maybe a little stability or something solid to think of, you maybe bring that rock inside and put it next to your, your coffee, and pick it up and hold it and just feel it when you need a moment. So there are many ways, as you said, to do this. And, creating your indoor space to be conducive is really a great thing to cultivate. It's really a great idea. Yeah.
Yeah. So now we do have research studies, notably by Dr. Qing Lee in Japan, and you had mentioned how all of this, was inspired by some of the Japanese movements of bringing people back into nature. And it showed that participants who spend time in the forest, and you had also briefly mentioned about the immune system, but his work was around increasing your natural killer cells, which play such an important role in disease, especially preventing or protecting you from infections and even removing cancer cells. And it can even last up to 7 days or more after the forest therapy session. Can you explain the mechanism behind this increase?
Yeah, well, I can tell you what is known. I mean, I think there's some of the details of that mechanism are still being understood. But when we are out in the forest and we're inhaling the atmosphere, we're inhaling all these organic compounds. There are like 20,000 different terpenes and volatilized organic compounds, one of which are these phytoncides. When we inhale them, we are also smelling them. And one of the mechanisms that's thought to explain the relationship between that and our natural killer cells is that when we are smelling phytoncides, first let me just say we know intuitively and certainly clinically that smell is a very powerful activator of hormones and emotions and thought. And that's because, again, our brainstem, this positive up, the way the olfactory bulb is connected to many of the parts of the brain that activate hormones. And when we smell phytoncides, this is the mechanism that's believed to be underlying this, it activates hormones and it lowers the stress hormones. By smelling those, the olfactory bulb is connected to the neuroendocrine, lower levels of cortisol, lower levels of adrenaline, and the modulation between those stress hormones and the natural killer cells that modulates the number of killer cells. So it's really by the olfactory bulb activating the neuroendocrine system through stress hormones that lower the inhibitions against the natural killer cells. We have more natural killer cells and more activity. They're activated as well as increased in number. In addition, the phytoncides that we inhale do directly activate our parasympathetic nervous system. So in addition to the stress hormone pathway, they directly activate our parasympathetic nervous system, which again, in turn, is tightly related to our immune system. I mean, these are, someone who loves systems, these are beautifully complex systems, but it's basically through that smell that the phytoncides are activating hormones and the parasympathetic nervous system.
Yeah. Wow. This is such a amazing topic. Before we started the podcast, we were talking a little bit about your program, about how nature is medicine. And I would like, to give this opportunity to put a plug in for your program and invite, if you're a healthcare provider and you're more interested in having preventative strategies in your practice and you're interested in nature. I know I'm interested. More than likely, I'm going to sign up for Dr. Abukayer's program. And if you're a physician and like me, you really want to implement more preventative practices in your healthcare provision, then I would highly recommend Dr. Abukayer's program. And Dr. Abukayer, can you tell us more about how physicians can get involved and sign up for this certification program?
Sure. This is a program for all healthcare professionals, physicians and nurse practitioners and nurses, anyone who is licensed in healthcare. And it's a 6-month program where we train healthcare professionals to be forest therapy guides, leveraging and building on the professional training you already have to train you to be guides and guide your patients, and then also training on how to incorporate nature into your clinical practice. Maybe we could share the website on somewhere, but there you can simply go to the website, and we're having a group. We started this already. It's just off and running. It's the first. It's really a great community as well as a training program, and we have another one coming up in October that starts, and another one following next spring as well. So maybe we could share the link.
Absolutely.
As you wish.
Yeah, we can put that in the show notes. So if you're a healthcare provider, like Dr. Bukhari said, not just physicians, nurse practitioners, physician assistants, anyone, nurses, if you're interested in learning more about this field, I will share all that information in the show notes. So thank you, Dr. Bukhari. Thank you for your valuable time and wisdom. And I truly believe that our audience has benefited with this information and will be more intentional about spending time with nature. I know I will be.
Thank you. Thank you for having me.
Of course.